The Doctor's Journal, brought to you by Medical Associates Hospital, Jameson and O Snacks.
Welcome to another episode of the Doctor's Journal, where we explore health topics to keep you informed and empowered. Today we delve into a common yet often misunderstood condition:
urinary tract infection, commonly known as UTI. Welcome to the Doctor's Journal. I am Dr. Mike.
And I'm Dr. Ryan. Let's explore what is a UTI. A UTI is an infection that can occur anywhere along the urinary tract, which includes the kidneys, ureters, bladder, urethra, and it's primarily caused by bacteria. It's most common in women, and that's due to the differences in anatomy.
Yes, Dr. Ryan. The most common symptoms include a strong and persistent urge to urinate, frequent urination, pain or burning during urination, cloudy or blood-tinged urine, and sometimes lower abdominal pain. In more severe cases, individuals may experience fever and chills. And there exist specific risk factors that make some individuals more prone to UTIs.
Yes, Dr. Mike. So these factors include increased sexual activity, multiple sexual partners,
existing urinary conditions,
lack of water intake,
long-term use of bladder catheters.
Pregnancy is also a risk factor that you need to know.
True. Menopause.
And diabetes. So Mike, time for you to go pass some urine for us.
Really?
Yeah, we have to know.
All right, find out why right after the break.
Thanks for staying with the Doctor's Journal. Today we're exploring the topic of UTIs, or urinary tract infections. Before the break, we discussed what is a UTI, but Mike, how do we diagnose it?
Great question. Well, the diagnosis is typically made based on a patient's symptoms and a simple urine test that we call a urine dipstick, or urine dip for short. It checks the presence of bacteria or white blood cells. In some cases, imaging studies may be required to assess the urinary tract's anatomy. So how do we treat it?
Most UTIs can be treated with a course of antibiotics prescribed by a medical doctor. The choice of antibiotics depends on a specific bacteria causing the infection and its susceptibility to different medication. It's crucial to complete the course of antibiotics as prescribed by your doctor in order to eradicate the infection completely.
That is important, Dr. Sunarayan, but there are also natural remedies for treating and managing UTIs. Dr. Sunarayan, and you know, we Trinbagonians love our natural remedies.
That's enough.
Antibiotics are the mainstay of treatment. There are some measures individuals can take to reduce their risk of developing UTIs, like staying hydrated,
practicing good hygiene, especially wiping from front to back, avoiding unnecessary use of irritating feminine products, as well as urinating after sexual activity.
Some research suggests that cranberry products may also have a preventative effect, but it's essential to consult with a doctor before relying solely on natural remedies. There's also a concern for recurring UTIs.
Yes, recurring UTIs can be concerning and require further evaluation by a doctor. So for some individuals, there might be an underlying factor contributing to the recurrent infection, such as a urinary tract abnormality or incomplete bladder emptying and kidney stones. It's essential to work with a healthcare provider to identify and address these issues to prevent further infections.
Right after this quick break, we will be joined by a specialist who will discuss how lifestyle changes can reduce the risk of UTIs.
Is it difficult for you to go to the doctor? Then call us today and get a doctor at your doorstep. Our qualified team of doctors are ready to help, and we specialize in convenient at-home care, including blood tests, pap smears, diabetes management, vaccination, and so much more. Get the care you need and get a doctor at your doorstep. Call 480-4DOC to set up an appointment or to get more information.
It's D-Best pre-Christmas sale. Start your Christmas shopping at dbesttoys.com now and save big. Shop gifts for the entire family all in one place. Get huge discounts on brand name toys and baby items, from action figures, arts and crafts, bicycles, tricycles, scooters and skateboards, tablets and Amazon Fire Sticks, building blocks, cars, trucks and remote control vehicles, desks, clay, dough and slime, educational and STEM toys, dinosaurs, dolls, doll houses and kitchen sets, board games and puzzles, outdoor fun, party supplies, school supplies, strollers, car seats and travel systems, baby bathtubs and potties, cribs and playpens, bouncers and rockers, walkers, jumpers and swings, high chairs and booster seats, gyms and playmats, shoes and clothing, changing pads, blankets, soothers, baby bottles, nursing and feeding accessories, and so much more.
Visit our store locations at Maclean Couva, Movitown Corner, Spain, and Eastgate Mall, Twin City.
Shop online now at dbesttoys.com and get free nationwide delivery. Avoid the Christmas rush and get the first pick of D-Best toys at D-Best prices.
Doctors Journal-UTI, and we're here at Freeport Flyover asking some patients some questions about UTIs. So, can you tell me what is a UTI?
Me know what is a UTI. What is a UTI?
Do you know what is a urinary tract infection or a UTI?
Yes.
What is it?
A urinary tract infection. I don't know exactly know how to explain it.
What is a UTI?
Urinary tract infection.
So close enough, urinary tract infection. That's good. So a urinary tract infection, where do you think you get that?
Yeah.
So anywhere along the entire urinary tract. So we're talking about kidneys, bladders, urethras, anything like that.
How does one get it?
Probably like keeping up your urine for too long.
Right, good.
And like having, as you say, the sex part, you're not keeping yourself clean.
Excellent.
Yeah.
So where is that infection?
Well, it has to be within your urinary bladder.
Okay.
So what are some of the symptoms of a UTI?
I think, guessing it burns when you go to the toilet.
Right.
I think that's it.
Maybe fever.
I never thought about fever as a...
What are some of the symptoms of a UTI? So let's say someone has a UTI. What may they complain of?
Maybe a little fever.
Okay.
As you get an infection, you probably get a little fever or pain.
Is there any treatment for a UTI?
I assume so, yes.
Fair enough, fair enough. And can someone get a UTI more than once?
I would assume so, yes.
So how do you treat a UTI?
By getting medical help.
Right, good.
Welcome back. Here with us today to delve into how the lifestyle changes can reduce the risk of UTIs and more is Dr. Adrian Ramkisoon, who is a urologist.
So, how serious would you say the issue of UTIs is?
A urinary tract infection, guys, is a very serious problem. And if not treated properly, you could end up escalating it and end up in the ICU, ending up in the hospital requiring intense antibiotics and serious care.
So what puts one at risk for developing a UTI?
Right, so the risk factors for UTI is guys who have, or women who have recurrent urinary tract infections. All right, incomplete treatment of a urinary tract infection. This is seen in a lot of patients who stop their antibiotics early. Having a pathological problem, such, for example, like obstruction in the urinary system. And this is seen in patients who have kidney stones, ureteric stones, bladder stones, or in men, as they get older, they have enlarged prostates and the inability to empty the bladder properly. It's also seen in our population who's very immunocompromised, especially our diabetics.
So if a male gets a UTI, would you be worried, and what advice would you give them?
I'll be extremely worried. A man should never get a urinary tract infection because if he gets one, he automatically gets classified as a complicated urinary tract infection. And a complicated urinary tract infection requires intensive care, all right, intensive antibiotics, and must be investigated properly so it does not return again.
So what treatment options are available for us here?
Well, in our little twin republic of Trinidad and Tobago, we have all the treatment options. Antibiotics is the mainstay treatment for urinary tract infection. For simple, uncomplicated urinary tract infection, oral antibiotics can do the trick. However, in those guys or women who have complicated urinary tract infections, oral antibiotics may be used, but sometimes and most times we have to step up to intravenous antibiotics and hospitalization.
So as we talked about antibiotics, is there an issue with antibiotic resistance?
Yes, antibiotics has been our savior. However, globally, antibiotics overuse, antibiotics misuse has been a big problem. Antibiotic resistance is growing. It's growing to the point where even doctors are becoming scared because we are running out of antibiotics. For example, when patients don't use their prescribed recommended dosing of the antibiotics, or as in Trinidad, as we say, after 5 days we're feeling good, we stop it. This leads to antibiotic resistance. Also, incomplete treatment can also result in antibiotic resistance. And if we have antibiotic resistance, the patient will require hospitalization and step up to more serious, intense antibiotics, which has some serious side effects.
Wow, so true. Now, what factors would contribute to make a patient have a recurring UTI?
A recurring UTI can occur in a patient because of two things. One, it can be an organic cause. An organic cause, or it could be a structural problem. An organic cause, we could have a patient who has a kidney stone, we could have a patient who has an enlarged prostate, we could have a patient who has previous surgery and had a foreign body remain, for example, a stent, or you could have a patient who has a fistula. Our population has a lot of patients who have diverticular disease, and they could develop fistulas between the colon and the bladder. And in these patients, we can see recurrent urinary tract infections. Also in females, because of the short length of their urethra and their close proximity to the rectum, they tend to get recurrent urinary tract infections very easily.
So what lifestyle changes would you suggest to these women then?
Well, I will tell them, 1, proper hygiene. Proper hygiene meaning always remember how the direction to wipe. 2, keep down there clean. Some recommend waxing, shaving. It's also recommended that after you use the bathroom, you take a wash. All right? These factors help keep the area clean. In addition, after you have sex, shower and clean up.
Yes, so if someone suspects or thinks that they may be having a UTI, what would you advise them to do?
Well, in that case, I will say seek attention from your doctor first. Please do not go to your local pharmacy and get antibiotics over the counter. You may actually be making a problem worse.
So what would be your final thoughts and anything you'd like to leave our audience with?
Well, I'd like our audience to know that a urinary tract infection, though it may seem trivial, though it may seem that, oh, I'm only going to pee very regular and it's burning, is a serious problem. And you should seek help from your doctor first, get diagnosed, get treated properly so you can have the problem rectified and don't have any more urinary tract infections again.
Thanks so much for joining us, Dr. Ramkisoon. Thanks for your time, your experience, and your expertise.
Thanks. Thank you for having me.
All right, stay tuned for more, guys, from the Doctors Journal. At Athena Clinic, we're committed to helping you boost your confidence and live your best life. Enhance your appearance with a non-surgical procedure or optimize your health with one of our expert doctor consultations and diet and fitness plans. Call today at 282-2262.
Are you looking for a customizable studio space with green and white screen cyclorama and professional production equipment to carry out your next big project? SGP Studios is the perfect fit for you. TNT's largest studio space with an overhead lighting grid and sound treated, perfect for television commercials, music videos, television programs, social media content, and film productions. We also have a wide range of production equipment available for rental. You can choose from a selection of Netflix approved cameras, modern lighting equipment, professional audio gear, 40-foot and 20-foot cranes, gimbals, drones, lenses, action cameras, and more, all at competitive prices. Whether you need a high-end cinema camera for feature film shoot, specialized lighting equipment for music video, or audio gear for a podcast, we've got you covered. And with our easy online booking system, you can reserve the gear you need in just a few clicks. Check us out online at sgpstudios.com.
As we discussed earlier, a simple urine dipstick can tell you if you have a UTI by showing presence of leukocytes on the strip. So we're going to check Dr. Mike's urine and see if he has any. Dr. Mike!
Yeah, buddy! I'm here.
Right, so we're going to check Dr. Mike's urine, and this is actually his urine, right, to see if he has any leukocytes present. So we're just going to dip it into the urine here, right, tap a little bit, and then lift it up against the bottle, right? Now we're going to see if we have any leukocytes, which is the first row. That first strip turns to a pink purplish color. So if we see it turn purple, then we know he might have a UTI, right? So I'm not seeing it turn yet. So good news for Dr. Mike, no UTI.
Hi guys, today we have a 54-year-old female who came to us in our emergency department with severe left flank pain. CT scan has shown that she has a big 1 centimeter stone blocking her left kidney. This is stuck in her ureter. So what we're going to do, we're going to put in a left JJ stent, which is a small piece of tubing, to relieve the obstruction and allow the kidney to drain properly. So come on, join me and let's see how we do this thing. Alright guys, let's go. Okay guys, so we are now inside the bladder. We have just passed our camera inside and we are watching right here, this little hole here, right here. That's where the left ureter, that's called the left ureteric orifice. That is coming directly down from the left kidney. So what we're gonna do, we're gonna pass a wire in, alright? And let's bridge the obstruction and then put our stent in, alright? All right, let's follow me up the road. As you can see there, guys, you see in the ureter. All right, as you can see an obvious defect there. Notice there's no contrast passing. Y'all seen it? So what we're going to use is a special wire that's going to bridge the obstruction. Now the wire has successfully passed the stone. All right, good. So as you can see now, you can see a very distended kidney. All right, this is the kidney that's been obstructed. So you see the image there, okay, guys? Good. All right, let's put our stent in. So we have just bypassed the obstruction in the kidney, and inside the kidney is really dirty. X-ray. Good. So as you can see, we have now passed back our wire, and we're going to pass our stent in. So we are actually going to watch the stent go inside here. So here we are, we're going to be putting the stent in now, okay? As you can see, the stent is going into the system. As you can see, the stent is in the kidney and the stent is in the bladder, all right?
With the stent in, it allows the urine from the kidney to drain properly into the bladder. This will allow the patient infection and obstruction to clear and allow her to return home to do her regular scheduled duties, and she could start back her job in a short space of time.
Nandini Samuel, a registered dietitian, and in today's segment, I will be speaking about urinary tract infections, also called UTIs. Studies have shown that cranberries and blueberries can be very helpful when treating UTIs, as they contain a compound called proanthocyanin, which prevents E. coli bacteria from entering the bladder walls. And I know it can be very difficult to manage UTIs for both males and females, but today we are going to dive straight into the diet. Probiotics are also very important, such as yogurt, kefir, kombucha, and sauerkraut. So foods which are high in fiber, let's just say like our rolled oats, lentils, beans, whole grains, and nuts, are known to help flush out toxins or harmful bacteria out of your body, as well as foods rich in omega-3, such as cold water fish, salmon, or mackerel, as well as walnuts, eggs, flax seeds, spinach, and cod liver oil. According to research, it has been shown that frequent consumption of fresh berries or juices and even fermented milk products, such as probiotics, can decrease the occurrence of a UTI. The recommended daily water intake is at least 6 to 8 glasses of water. So in today's recipe, we will be preparing a healthy lentil cranberry salad. So here in front of me, I have some chopped kale, we have some cranberry, chopped tomato, grated carrots, some quinoa, some lentils, chopped sweet peppers, we have some parsley here, as well as some olive oil and lemon juice. So now we are going to assemble our healthy lentil cranberry salad. So what I want to do first is add our chopped kale. Guys, you could actually use lettuce or spinach as your green vegetables, or even add in some broccoli as well. Then we want to add in our grated carrots. Our quinoa. Our pre-boiled or pre-cooked lentils. Chopped tomato. Chopped sweet peppers, and last we want to add our cranberry to the top and some dried parsley flakes. If you have fresh parsley at home, you could always use that as well. We want to give this a good mix before adding our salad dressing. Right, so now what we are going to do is add our lemon juice or olive oil, and this is optional, guys. You could always use a salad dressing with yogurt or even sour cream, and then we want to pour it all over our salad. Lentils are very fibrous, so again, this has shown to be very beneficial for UTIs as well as cranberries. And there we have it, guys, a healthy cranberry lentil salad.
This segment was brought to you by O Snacks.
We hope this episode has provided valuable insight to our audience. Remember, if you suspect you have a UTI, don't hesitate to seek medical attention. And stay hydrated, guys.
Thank you for joining us on this episode of the Doctors Journal. Be sure to tune in next time for more enlightening discussions on health and wellness. I'm Dr. Mike.
I'm Dr. Sunrain. Take care of you for us.
The Doctor's Journal was brought to you by Medical Associates Hospital, Jameson, and O Snacks.